I'm Richard from CMHA. I'm the education lead at the organization. Basically, what that means is I oversee all the education and training that goes on in the organization. So, coordinating everything that we do internally for staff at the organization, as well as working with our various community partners and facilitating trainings and workshops, such as the one I'm doing for all you folks today. So I'm very happy to be here talking about mental health and workplace accommodation. So we're going to be going over. Well, there's a few different aspects of workplace accommodation and things to consider, and there are certainly principles and legal standards that we're going to go over, but I'm also going to be talking about best practices as well. I tried to keep things this morning as general as possible. I know we probably have people here from a variety of different workplaces, different experiences, but also different types of roles and environments that you're probably working in as well. So I wanted to make sure I kept everything as general as I possibly could for everybody. But there are a few best practices I'm going to go over as well, which are going to be applicable to pretty much every workplace. So I hope you find it enjoyable. I believe we are going to be taking questions towards the end of the webinar today. Angelica is keeping an eye on the chat for me. So if anything comes up for you, please feel free to put it there, and we'll try to address it towards the end. So let's get started. Oh, okay, here we go. I just wanted to start us off by going over really what the impact of mental health challenges is on the workplace these days. So these are statistics from 2022, which I think is interesting if you consider the timeline. We were just coming out of a pandemic, but right around that time, according to this data, about 5 million Canadians met the criteria for a diagnosable mental illness. It's something that's quite prevalent in our country, and I think when you think about people that have friends, family members, colleagues that might have a diagnosis or be experiencing issues, all the people that go undiagnosed throughout their lives, I think it really is something that touches everybody at some point. In one way or another. And that's what that 1 in 3 statistic there, I think kind of indicates too, just that, really everyone is affected at some point. And the amount of people that really I think about the amount of people that aren't aware that they might have any issues or experiencing challenges. It's really a problem. Addressing mental illness in the workplace can be very complex, and I know many workplaces struggle, but you'll see there from the following stats, there's a really big cost for companies, and just really want to highlight that the ramifications of not addressing mental health challenges in the workplace can be quite high. Um, You'll notice there's a stat on disability claims represented that are actually claimed under mental illness, and it is kind of a small number, and I think there are a few reasons for that. Mental health resources are often very costly, and depending on where you're working, there may not be resources you need that are covered. Lots of people, we're in a very diverse country. There's lots of different views and opinions about mental illness still. I know coming from a family with lots of older English relatives, there can be kind of this attitude of like suck it up or like the stiff upper lip kind of mentality, which is not helpful. In addition to that, though, resources that support people are often, those are often costly. Therapy, for instance, is not something that just kind of solves a mental health challenge just in one sitting, right? It can take multiple sessions and things. It can often take months or years to get to be working towards recovery if that's one of the only resources you're utilizing. And as I mentioned, mental health issues can go unchecked for a lot of years. So, not addressing it as the years go on can make things become even more complex. I do want to highlight that it is possible to live with a mental health condition and still be in good mental health. And you can also have, no diagnosis and maybe not living with a mental health issue. And you still might not have very good, overall mental well-being, right? There might be situations where people are under a lot of constant stress or people might not have really good coping strategies at their disposal, for instance. So I like to clarify that because having a diagnosis is not necessarily all doom and gloom, but it does have a very big impact, and we spend a lot of our time at work, so it really takes a toll after a while. Um, I just wanted to highlight here just a few symptoms that you might notice someone who might be in a mental health crisis or possibly a substance use crisis. I want to preface this by saying, this is not the definitive, kind of view of someone who's experiencing a mental health challenge, right? There might be an array of different things that you might be seeing. But I included all of these, especially because these are all things that would definitely impact work performance. Crisis situations and mental health challenges really take a toll on the person, and they also take a toll on those around them as well. It can be really difficult to remain responsive rather to individual needs. And I think it can be easy sometimes for people to kind of miss what's going on with their colleagues too, unfortunately. We're going to talk more about supporting your colleagues though too, but I just kind of wanted to include this quickly just to highlight things that you may or may not notice. Um, a couple more stats for people here. So these stats are a little more recent, just from last year, from the Mental Health Research Canada. So, and I thought these were interesting because about 3 out of 4 managers, you'll see there, just a little over 75% of managers or supervisors reported having training to intervene with employees who were showing signs of depression. Interestingly, I also noted in there that 55% of managers or supervisors have reported having intervened at some point during their time in their role, I think, which is a pretty good number. It maybe shows a little bit of a shift. However, only a little over half of working Canadians agree, and I say quotes there because there was kind of a mix of moderately agree and somewhat agree. I noticed in there. They felt that their workplace would be supportive through a mental health challenge, and it's not to say that these are necessarily toxic work environments, but I think it can show that there is a bit of a disconnect sometimes between what managers are seeing, what might be available in the workplace, or just the general environment of the workplace as it exists, and as well as what employees might actually be experiencing day to day themselves. So it is nice to know that I think people that are in positions of power at companies and organizations are starting to build that momentum to feel like they can kind of get involved a little bit more. But I think also from an employee's point of view, there's still a little bit of a ways to go. So yeah, interesting. Um, this is kind of just an overview of what that can look like though when a workplace is taking those steps. I won't spend too much time on this one because I think the outcomes are pretty self-explanatory, and they're all these are all excellent reasons to address mental health issues early on. But more importantly, I think about just really building on certainly that last one there, like building on employee engagement, making sure that there's a culture of trust in the workplace, and just a level of connection that employees can feel like they can go to their supervisors, they can talk to each other. I'm going to be talking a little bit about fostering a really mentally healthy, inclusive environment. So I hope everybody walks away with kind of those tips that might be able to help. But let's continue on. So these next couple slides, I just want to preface are I'm going to be kind of going over the legal sort of policy side of mental health accommodation in the workplace, and I am not a full-on expert in all of this, and my other goal was to lay information out just as nicely as possible, that it was clear, and like I said, that it would apply to any sort of workplace. So my hope is that people can kind of have really good takeaways from this. I'm much more focused on, or much more knowledgeable about the supporting people with mental health challenges, but I think, do a good job of kind of putting together the key points for you folks. And if I'm not able to answer questions about the next couple slides at the end, I will certainly point you in the right direction of where I found the resources, and I'll definitely be happy to share those. But let's talk about duty to accommodate people with psychosocial disabilities. Okay. So yeah, as I said, the next few slides I'm going to be reviewing a lot of this more in depth. Whoops, sorry, I'm just trying to move couple things around on my screen here. Anyway, I'm going to be reviewing both the Ontario Human Rights Commission and the Accessibility for Ontarians with Disabilities Act. So, interestingly, the AODA aims for a fully accessible province in Ontario by 2025, which is really exciting to look forward to, hopefully this year. But these are kind of all the general guidelines that organizations must comply with when it comes to accessibility standards in both public and private sectors. And this is these are the guidelines that really prevail if there are any issues with the return to work process, looking at those AODA standards. So. You'll see here, I have the principles of accommodation as set by the Ontario Human Rights Commission, and I'm going to be breaking those little rectangles down, those following four in the next few slides. I'm going to be talking a lot about because they're kind of the overarching themes of these are kind of broken down into two areas called substantive duty and procedural duty. So, substantive duty means meeting the needs directly of people with psychosocial disabilities, where procedural duty ensures proper procedures are followed in the accommodation process, more so kind of in the workplace. Um, and the duty to accommodate mental health disabilities really should be as rigorous as for physical disabilities. There's probably been lots of examples where that hasn't been the case, unfortunately. It can be seen, for instance, as discrimination when if an employee needs a leave of absence for work for stress reasons, because they have anxiety. If that's denied, when in contrast, your organization has a really generous and robust kind of leave or a package plan for people with physical disabilities. So the standards really should be the same, and I know that that's what the governing bodies are kind of working towards. Um, I know even from my own experience, like I have been on leave for my own health issues. Last year I was actually off for it was a physical health issue. And I just if for people that haven't really been through this experience before or haven't been aware, the disability claims people were very on me about everything from making sure I was submitting my documentation on time, making sure that I was attending appointments, and even really pushing me to confirm when I was coming back to work. So I just want to clarify, and I have actually been off work for mental health reasons as well. But I just want to clarify, as someone who's been through it for kind of both reasons, the process is very similar, and it's it can be rigorous. I think there's a misconception sometimes that people with mental health challenges, kind of have this easy time getting their needs met. And that's not necessarily the case. It's great that these processes are being put in place, but it's fair treatment for everybody, from my experience at least. I just want to say so. Just want to preface that as we go on. So. The first one I said I was going to talk about was respect for dignity. So, this one, I mean, should be pretty self-explanatory. I think we all have the right to a dignified work experience, and that includes returning to work after a mental health issue. Really want to highlight the importance of confidentiality for individuals with mental health challenges, disabilities, or addictions. Um, Confidentiality is really vital due to stigma, stereotyping, and also just, our general rights in the return to work process and as employees too. We all have the same rights to return to work feeling like it's a harassment-free and kind of safe experience. So, um, there could be different examples of when this is kind of violated for an employee. I'm going to be talking in one of the upcoming slides more in depth about sharing medical information and storing medical information. But even if that's done incorrectly, it's a violation of privacy, and it can create a situation where it's, a discriminatory kind of environment, right? Yeah, documentation is very important when it comes to this one. So, making sure accommodation requests are also shared only with the necessary parties. That could be your human resources team. You might have an accessibility coordinator at work who's assisting in the return to work process. If there's any managers on the call, I'm going to talk about this a little more later too, but I just want to clarify, and employees as well. But no one is alone in these situations, for the most part. We all have a director or a supervisor of some sort that we can look up to. We all have human resources. We all have employee assistance programs. If you are the employee yourself, you hopefully have a team of health professionals that are really supportive. So no one is really alone going through this, right? I know it can seem daunting sometimes, but it doesn't have to be like that. It can be as seamless as possible. So. Um, Individualization. So this is where I talked a couple slides ago about substantive duty, which means meeting the needs of people, the people themselves with the disability. So there's the requirements for an individualized return to work plan. So according to accessibility standards, it really needs to meet individual needs. Accessibility standards need to be identified and barriers need to be removed for the person. Barriers could be, physical, technological. Sometimes barriers can be relating to the culture of the workplace, sort of attitudinal. Um, and workplaces must also do what they can to prevent future barriers as well. When implementing the individual's return to work plan, persons or organizations must implement these measures within specified time frames. So these are all kind of agreed upon between the employer, HR, healthcare professionals. There's usually a disability claims coordinator involved with the process. Um, and yeah, all of these things kind of need to be looked at in terms of making sure the employee returns to work as safely and effectively as possible. Okay. Um, and this is kind of where that other piece, kind of procedural duty, kind of comes into play. So ensuring that proper procedures are followed in the accommodation progress. So integration and full participation really means maximizing those opportunities for an individual to be fully immersed back into their role at work. In human rights law, when it comes to employment standards, it's well established that there may be different treatment of individuals in their return to work as long as it does not offend a person's dignity. And sometimes there may be barriers that can hinder a person from performing their role, which are impossible to remove. And I think accommodations should be made in these instances as well, unless it causes undue hardship. And again, I'm going to be talking about a little bit further about workplaces that can be designed in a way that creates an environment of inclusivity for everybody. So moving on. Okay, so I talked a little bit about confidentiality earlier. Confidentiality is a crucial piece to all of this due to the stigma surrounding mental health and of course the issue of equal treatment. So there's a few things to go over regarding best practices for maintaining confidentiality. Um, Documentation. I mentioned I was going to be talking a little more about that. So anything that is written that supports accommodation requests or anything to do with the RTW process, it needs to be shared only with the necessary personnel that are involved in that process itself. So, an example of that could be health professionals to HR to an accessibility coordinator at the workplace. Um, and there's a lot of different examples where these bodies I think might communicate uh separately or just a couple of them outside sometimes, like a health practitioner, for instance, which could be a therapist, a psychologist. They might have to disclose information to a family physician, for instance, if necessary, if they believe that there may be a risk of harm in the process. In Canada, the sharing of personal information in the workplace is governed by a combination of different privacy laws. Some of them are federal, some of them are provincial, depending on the nature of the information and the jurisdiction of where it's happening. Um, but you can find a lot of that information as well on the Personal Information Protection and Electronic Documents Act. Um, Record storage. So record storage processes should be handled with care. Medical information actually needs to be kept separate from personnel files. That's something I wasn't actually aware of as I was kind of updating the presentation. But yeah, those need to be stored separately. Um, as I've established, mental health information is very personal. Um, so under the Documents Act, employees must ensure that information is kept separate from other employment records to reduce risk and maintain confidentiality, of course. In the Act, you can find further information around guidelines to around electronic storage versus physical storage, and there's policies on retention and disposal of information. So, um, if you're wanting to read more about that, I highly recommend looking at that, the Personal Information Protection and Electronic Documents Act. And yeah, so disclosure. So generally under the same act, disclosure usually occurs with usually with explicit consent from the employee in this situation. Disclosure of health information may be necessary in certain health and safety situations, but it must adhere to privacy laws. And there may be situations where disclosure is required without consent. Disclosure can happen when necessary to address safety risks. An example of that, I mentioned like a healthcare practitioner might disclose personal health information to a family member or physical physician for safety reasons, like if someone's life is at risk, is what I'm referring to there. There may be legal obligations sometimes, or there might be regulatory purposes and the whole process of the return to work. But generally, explicit consent, that piece is crucial to all of this, and it must come from the employee themselves. It's a very key component of confidentiality. So, I want to talk for a couple slides about rights to treatment because treatment is can be a very big component of the return to work process as well, and treatment can look very different depending on the individual. And as I was preparing for today's session, I was thinking to myself, it's really interesting just in terms of people's autonomy and what they feel, what sometimes people feel like they need and what they should be doing, and that may not always fall in line with their circle of care or their workplace, for instance, I'll say. So I just wanted to highlight a couple key points here. So treatment is a personal right. And all individuals have the fundamental right to consent or refuse treatment, which is protected under the Charter of Rights and Freedoms. And there are issues with imposing treatment on an individual. It's a violation to force someone to go through different types of treatments, and that can include, medications, therapy. It's definitely a violation in different situations in terms of being a requirement, like for housing, for instance, or other services, and that also falls in line with employment as well, unless it is determined to be kind of like a bona fide need. Examples of mental health treatments, by the way, can vary. There can be lots of, that can look like a lot of different things. There's different types of psychotherapy, for instance, like cognitive behavioral therapy. Some situations might require an individual to go to family counseling or group therapy of some kind. Medications certainly fall under the realm of treatment. And there may be all other alternative therapies that people might want to do. There might be, mindfulness courses or electroshock treatments. There's a pretty broad range of things out there that people do. Treatment requirements and accommodation are determined when they are kind of put up against the Mayoran legal test. So what is that, you might ask? The Mayoran test is a legal test that is used in Canadian human rights law to determine whether an employer's policy can be justified as a legitimate requirement. And it gets used to justify, in these situations, it gets used to justify treatment requirements that organizations try to prove are legitimate, and trying to prove whether they are reasonable or necessary for the RTW process. It all gets put up against the Mayoran test, and then essentially it's decided as to whether that treatment will be a mandatory requirement or not. Um, Yeah, and all assessments are individualized as well, like I said. So all accommodation decisions must be based on individual needs, not blanket assumptions about people with mental health disabilities. Assessments are designed to accommodate rather employees' specific needs, ensuring that they can return to work safely and effectively, adhering to legal requirements. Um, and again, main reason I brought this up is because there may be situations where the employee may not be on the same page, let's say, as what's being recommended to them. So, all individuals do have the right to refuse treatment. Sometimes there are kind of challenges around that, though. A consequence of refusal, is that it may. I mean, really, the most challenging one would be is that it affects an individual's ability to perform essential duties, or it affects their ability to kind of work under accommodations. If an employee does refuse treatment that is recommended by a medical care, they may not be required to make accommodate, or the employer rather, may not be required to make accommodations beyond what is reasonable or necessary for the employee's condition. So it's an interesting point because the employee and the employer do kind of have to meet each other halfway at some point. Like, yes, the employer needs to do everything within their power to accommodate the employee's needs, but the employee also needs to make sure they're feeling positive about their return to work plan as well. And it can take time in some instances to kind of land the plane, let's say, in that way. Um, Refusal to undergo treatment can undermine the employee's ability to fully recover or safely return to work, which can limit the accommodation the employer is legally obligated to provide. And this has an impact on accommodation itself too. So employers may argue that without the employee's cooperation in receiving treatment, they can't determine what accommodations are necessary, and this creates all kinds of difficulties, as I said. Um, but hopefully those are worked through. Like, return to work agreements can always be readjusted to conditions on return to work agreements can be altered. And it's again always an individualized approach, right? Return to work agreements are not kind of blanketed all across the board, and that they're not the same for every single person. I want to clarify too that accommodation is not the same as treatment. So, employers and service providers are not expected to provide the treatment or counseling. So, employers, for instance, are not responsible for providing therapy to the employee directly. They're not responsible for overseeing medications or anything of that nature. And they're not directly responsible, I'll say, for any, alternative pathways to wellness. Although I am going to talk about ways that workplaces can enhance the well-being of employees in a little bit. Um, Employees, employers can provide flexible work hours for employees undergoing treatment as well. So that's one of the ways that people can look at being flexible. Um, so let's talk about the role of the manager for a little bit, or the role of the supervisor, let's say. So in these situations, I certainly appreciate it. It can be tough to always know what to do. You don't feel like you want to say or do the right or wrong thing. Um, one of the first things you want to make sure you're doing is informing the employee of the possibility of accommodations. So really keeping the door open to the fact that, you are working towards making the workplace as best as it can possibly be for the employee to be successful. And then from there, making sure you're providing them access to the employee assistance program if you have one. You can refer them to community services that are available. I'm going to be sending Angelica, I forgot to send it to you earlier, but I'm going to be sending you a resource that maybe we can send out to folks that have registered today. It's our CMHA Quick Guide, and it has basically every organization that provides community services in Peel region is listed in this quick guide. Um, and it's all broken down into sections too. So it's like really all of anything you might need in your community is listed in there, and it's very comprehensive. We update it every couple of years, so it's up to date, and we have an electronic version of that. So I'll make sure that or maybe I can put it in the chat too. We'll see if I can do that towards the end. Um, During your conversation, I digress. During your conversations with your employee, though, managers, you want to make sure you're keeping the focus on the work tasks and approaching your concern as a workplace performance issue, making sure you're not personalizing things too much, right? Um, Always make sure you're setting up time to meet again. So really keeping that open door policy. Want to make sure you're reviewing performance. When you're documenting meetings, this is just really good for workplace culture, but also, I think especially during the return to work process. You want to document meetings in an objective fashion without any commentary, right? So you want to stick with the facts, avoid any perceptions that you might be having. Just stick with what happened in the meeting. Um, there are laws around recognizing workplace environments as contributing to the safety of workers, and you can think about that too, including those frameworks into any policies you have around harassment, workplace violence. So really kind of thinking about putting policies in place there that help the whole workplace culture feel a little bit safer. Um, but really, when you're approaching the conversations themselves, you want to think about like if I were struggling at work, like how would I want my manager to treat me, right? If I were off work, how would I want my manager to communicate with me? And what does all this look like if I'm returning to work after a sick leave? What would I find helpful from my manager? So kind of really putting yourself in the employee's shoes as much as you can. Um, this kind of highlights, I mean, good for everybody, but I think for, employers, kind of the the things you can control when in life, but also in these situations. And you know what? I think it's challenging maintaining a focus on this just in our day-to-day lives anyway. To be fair, there's a lot of things that prevent us on focusing on enhancing our one-on-one interactions and making them the best that they can possibly be. Sometimes this is time, resources with mental health situations. We might not feel like we have the knowledge. We might not, if we're in the workplace, that we might not have a lot of direction from above in terms of policy or in terms of how to approach situations in the best way. Um, but there are these things that we all do control in our day to day, and really we are the ones that make these decisions every minute. And sometimes you do it without realizing it, right? So like, our communication. So like what you say and how you say it. really can really alter the course of a conversation. Just your like your tone of voice even. Your actions, the things that you do, and the things you choose to do, actions you might take to help support your employees, for instance, or your colleagues. Your behaviors. How are you acting around your employees or your colleagues? Are you being respectful? Are you behaving in a way that allows for dignity or for the person experiencing a mental health issue to feel safe? Effort. Yeah, I mean, absolutely. How much time and energy do we have in any given day? How much of that are we able to invest in a situation today? Um, I talked a little bit in the last slide about setting up specific times to meet with employees. So again, always keeping. I'm honestly a big fan of setting up meetings. I find some of my colleagues will just like shoot me a phone call or send me a Teams message, and they'll want to have like this really big discussion about things right in the moment. I don't really work that way, but I am huge on let's set up some time to talk about this, and then I can really kind of plan my day or my week, and I can really kind of dedicate fully, I know it's kind of ahead of me each day, and I can kind of fully dedicate my energy to that, right? Um, and yeah, your ideas, it's an interesting one. Like, really thinking about, is it a good time to share my ideas, or maybe it's just a better time to do some listening right now? Do we explore situations with curiosity, or do we just kind of take the time to kind of be attentive and thoughtful? All the choices that you make really, really have an impact. But I included this because as an employer or working with an employee with mental health challenges, you're the one in a position of power, right? And really, a lot of this really dictates a lot of aspects of this situation. I think, not just how the employee feels, but even sometimes how smoothly the process might go too. I'm gonna keep moving things along because I've got a few slides left. See, I could talk about all this mental health stuff for hours now. Okay, so let's talk for a few minutes about learning to have a challenging conversation. So, you want to make sure you're taking time to collect all of the information, especially in a return to work situation. You want to go into a situation where, you have all of the factual information that might be happening with an individual. Um, you can consider a lot of things when going into these situations, looking at changes in behaviors. So what has changed? How long have these changes been going on for? Um, how have you seen the individual impacted by these changes? This might trickle down to changes in their work performance too, right? And like I said, kind of focusing the conversations on workplace issues. So, what's changed there? How long has this been going on for? Um, Really considering, what might be causing these, but focusing on approaching the situation as a work issue, as I said. There may be other changes going on at the workplace too. You might be in a workplace where there's a lot of turnover. There might be new supervisors, changes to your team. Um, Framing the conversation can feel, or figuring out how to do that can feel like a big thing, but I mean, it doesn't really, it's approaching someone with a mental health challenge is just like approaching any other situation. It's just framing it in a way that conveys empathy and understanding. Like, hey, I've noticed you were a little withdrawn during that team meeting last week, and I'm concerned because you were really excited about taking on that project and getting that up and running. I'm wondering if there's anything I can do to help out. How can we make sure that you're set up for success? I want to make sure that you're doing well, and I want to make sure we get back to a place where you're feeling really positive about this, right? Something like that is really all it takes. Doesn't have to be this big huge thing at first. Making sure you're listening to understand. So giving the person time and space, really finding moments to validate and check for clarity and understanding, finding moments to ask if and when you can help, um, validating people's needs for accommodation, right? I think in the return to work process, there could be sometimes shame or embarrassment on the part of the employee. They might not be able to do as many things as they used to do. And you want to really validate that this is a normal process that literally, I went over the stats earlier, millions of people go through mental health challenges in our country, right? So just really kind of framing it that way too, just making it like a normal issue there. Please make sure you're approaching these situations collaboratively, of course. So the process of planning and implementing an employee's return to work involves various stakeholders. And I mentioned this earlier because I don't want anybody to kind of feel like if they're going through this right now, they're alone. But, this includes healthcare providers, the employer themselves, HR, third-party professionals. There may be occupational health specialists that are involved. There certainly was when I've been through these processes. There may be other sort of rehabilitation experts. The list can go on and on. Um, the employee should be always making sure this is the biggest responsibility of the employee that they're communicating openly with the employer about their condition, their limitations, and their progress as well during the recovery. And they may also provide a consent to share medical information, undergo assessments, depending on legal and privacy requirements. Um, Accommodation requests may be difficult to obtain if the individual is unable to communicate these issues, of course. So a lot of the responsibility is really important for the employee. Um, Managers, supervisors, direct supervisors are key, of course, at ensuring that any accommodation or changes to the job duties are put into place. You are responsible for ensuring that the employee is reintegrated into the workplace in a safe and supportive manner. And again, HR is your friend in all this. HR professionals often play a very significant role in coordinating the RTW process. They ensure that policies are followed and that they are helping to facilitate communication between the employee, healthcare professionals, and all the other stakeholders that I just mentioned. Making sure you're checking in. Yeah, so always, I think especially at first, it can be helpful to make sure you're setting up times, places. Consider, of course, places that maintains psychological safety and certainly confidentiality and privacy. Um, don't delay or ignore meetings to talk about accommodations or just, how an employee may be doing. I think it's important to try to keep that open door policy as much as you possibly can. I mean, we're all busy and we need moments to ourselves, and there's meetings and phone calls that come up throughout the day. But as much as you can, being prepared to kind of sit down with your employees. Um, Recognizing and helping the employees to get back on track. So I talked a little bit about resources that I'm going to provide you, which I highly encourage everyone to look at, and you can provide those to your employees and spread them to your networks. Create those opportunities to stay in touch. You can adjust timelines if necessary. As I said, the return to work agreements may change over time, but you always want to focus as much as you can on positive feedback and constructive feedback too. Um, Taking a look at both and making sure you're keeping everything confidential. This is a really big part of this process. I feel like I've said that word a million times today. Um, a little more on having a difficult conversation. So, really important to just practice those listening skills, right? Being aware of your nonverbal communication, maintaining appropriate eye contact, leaning forward, nodding your head. Um, Please don't try to diagnose people. That can get very tiresome, and a lot of the time you might be wrong. But but instead of diagnosing, I mean, wild idea. Just respect the person as a person, and really just take into account how they're feeling and how the impact of what they might be going through. Making sure you're asking open-ended questions, keeping an open mind. Examples of that, how was that for you? What would be helpful for you? Lots of questions like that are really good to kind of keep a conversation moving. Be patient, avoid interrupting the individual when you're talking to them. Provide time for the person to think and finish what they're saying. Listen for their needs, intentions, and feelings, and just try to validate and normalize as much as you possibly can. Um, I'll just keep moving on. Oh, keeping an open mind is just, I mean, it's very important though. I heard a colleague of mine speak a couple weeks ago at a work event, and she was talking about how when she first started our organization, she had just had her newborn baby, and it really just dawned on her that like, we all show up to work with a lot of baggage sometimes, we all have so many things going on in our lives, like family members, friends, life stressors, people with health issues, people with mental health issues, pets, like, the list goes on and on, right? All these things that just are immensely challenging, and we have to show up to work as the best versions of ourselves. And, we do a good job of that, right? We do what we have to do, but it can feel tiresome sometimes and tedious. A couple more things to keep in mind when it comes to accommodations. So, accommodation requirements, as you've guessed, might not always be easily identified, but if you or if you know someone who might be going through this process, there's a couple things to consider. So, take notes during the entire accommodation process would be my recommendation. Take notes during all your conversations with employer, HR, claims coordinator, whoever you might be speaking of, your healthcare professionals, of course. And making sure you use your kind of circle of care, your doctor, your healthcare professional, who can assist you in defining rather what you can do and cannot do. Um, Timelines are helpful as a means for assessments of progress. And again, this is something that may need to be continued to be looked at and adjusted. Um, at the end of the day, appropriate accommodation must respect dignity and respond to the needs and fully support the individual. It should be appropriate to ensure equal opportunities. And it's a process that is really a continuum, starting with the best possible accommodation, unless it causes undue hardship, and making alternative accommodations, which may be used temporarily while the best options are being implemented. This ensures that employees can discuss needs um, without feeling unsafe, and that organizations can actively identify and remove existing systemic barriers. Okay, I know I'm running a little short on time, but I'm doing okay. So I just wanted to talk for a minute about inclusive workplace design. This is one of my favorite slides because I find so many workplaces are so different. Not everybody is able to implement all of these things, but I think all workplaces can do at least a few of these things. So I just want to talk about these for a second. So this is what an inclusive workplace really looks like for people with mental health issues. So fostering a supportive and open culture. So making sure that employees feel safe to discuss mental health concerns without fear or judgment, discrimination. And this can be achieved in a lot of different ways. Making sure there's open communication from leadership, and that leadership are leading by example. You can implement policies that actively combat stigma related to mental health challenges, and this can include promoting respect for people with different diagnoses or conditions. You can implement policy around positive language around mental health. The list goes on and on. Um, Making flexible work arrangements. So, allowing employees to work at times when they feel most productive or when they need to take care of their mental health. If possible, again, I know it's not possible for everybody, but offering remote or hybrid work is something that really can reduce stress for employees who may struggle. Um, it's not easy getting out the door in the morning, you know. That's something that's something we can all relate to, I think, many people have kids. I have a dog. Just getting out the door with her some days can be a lot of work. Today the weather was miserable. Like, oh my gosh, it's there's a lot of things that just make our day that much better in the morning, right? So if you have the option to work from home, it can be nice. Um, Making sure you have a mentally healthy, friendly environment. So, this is something, again, this could look different depending on the workplace, but you can do things like designating a quiet area where employees can take breaks, maybe meditate or decompress when they feel overwhelmed. These spaces should be made to be calm, of course, free of distractions, private spaces, if possible. Um, you can ensure that your workplace is as well lit as possible, preferably with natural lights. But if not, you do what you can. Making sure that there is comfortable seating available, seating that is hopefully aesthetically pleasing, and surroundings that are aesthetically pleasing can really help. This, I mean, it sounds kind of maybe sounds a little silly to some people, but it can really reduce stress and improve, people's comfort level while they're at work, right? Clear and supportive communication. So supervisors and managers setting clear expectations for tasks and responsibilities. We talked about open and regular check-ins a lot today. Making sure you're scheduling those, focusing on providing constructive and encouraging feedback, making sure you're providing resources and that employees are aware and comfortable to access those. Training is a really big one. Make sure that all employees and managers are trained to recognize and address mental health issues and concerns. We do have many trainings available at CMHA, by the way. Feel free to reach out to me for more information around that. But these can be really helpful though for addressing these challenges. And there's a lot of trainings that we do that include learning to approach these situations with empathy and more understanding. And lastly, of course, just encouraging a work-life balance. Okay. These are just some additional workplace resources. I think all of them are kind of fairly obvious. I'll just get to my last conclusion slide here right on time. So, in conclusion, creating an inclusive workplace for people with mental health issues requires everybody to be intentional. It requires actions that are intentional, that promote support, flexibility, and understanding. And by fostering a culture of openness, um, which provides appropriate accommodation, designing supportive physical organizational structure, and offering accessible mental health resources. These are all ways that organizations can help their employees with mental health issues thrive in the workplace. So With just a minute overboard, I am going to wrap up there. So thank you, everybody.